Are you one of the millions of people who suffer from IBS or irritable bowel syndrome? Are you frustrated by some of the treatment options you have been given? In today's video, I'm going to give you 6 recommendations that I have that I recommend to all my patients when it comes to dealing with their IBS naturally. If you're having IBS issues, this video is for you. Hi y'all, I'm Dr. Islam. I'm a board certified gastroenterologist trained at the Mayo Clinic. I have over 10 years of treating thousands of patients with IBS successfully. If you haven't already, don't forget to smash that like button, like, share, and subscribe. And if you're having issues with your gut like IBS, come see us up at Gastro. We can incorporate my recommendations to get you feeling better and help you get your IBS under control. Now, IBS is a chronic condition, and there are things that we can do to help out naturally when it comes to IBS. Here are 6 steps that I'd recommend to help control your symptoms. Step number 1 is fiber. Now, I want you to be careful about this. Fiber is a dual-edged sword when it comes to my individuals and patients who have IBS. For some people, it can make them feel great. They can incorporate more fiber, but for others, it may cause worsening issues. So when it comes to fiber, I want you to remember a couple of things. Number 1, use soluble fiber. Things like psyllium, these are the best fibers to recommend. Number 2, use a synthetic fiber like benefiber or citrusil. It works great. It doesn't cause a bloating side effect and gets you feeling better. And tip number 3, go low and go slow. Use a small amount, maybe 1/4 teaspoon for a week, do a half for a week, do 3/4 for a week, and just titrate up slowly over time. Your gut is a mess because of your IBS. And so if you try to add in more fiber to your diet immediately, especially supplemental fiber, it's gonna make it more difficult for you to digest and make your gut issues a lot worse. So go low and go slow. But also when it comes to fiber, try to incorporate fibrous food as well, because not only are you getting the fiber, you're getting the benefits of vitamins, minerals, and nutrients that come with that. So my tip for you is to gradually increase your fiber to avoid flare-ups. Tip number 2, manage stress. It is real, and there's a real connection between the brain and the gut. The more stressed you are up here, the more you're gonna have gut issues, the more stress you're gonna have. It's gonna end up being a vicious cycle. We have to find some way to break that cycle. And so there are a lot of ways to manage stress that have been shown in clinical evidence to help out when it comes to IBS. So exercise works. It's free, it's fantastic, you can do it anywhere. Yoga works, meditation works, journaling, hypnotherapy. These things actually work when it comes to stress, but also helps to minimize the gut symptoms that can occur as well. So find ways to minimize stress in your body. And I'll tell you, if you can't find a way, you're having difficulty with that, use medical therapy to get over the hump. It is okay if you need to take an antidepressant. It is okay if you need to take an anti-anxiety medication. Don't be ashamed. Don't be scared, because our goal is to get over this cycle that you're having. And we use these medications commonly in my IBS patients to help out with the gut-brain axis. It is a real condition that we're treating, and we use these medications at low dosages to help out, to help soothe the gut, to relax the gut, but also help out with your mental well-being. And that's okay. I don't want you to be ashamed if you have to take a medication like that. And tip number 3, avoid trigger foods. Now, every single IBS patient has their own particular trigger food. It's not typically universal, but there's some universal recommendations that we have. Number 1, eliminate processed foods and fried foods. These things are known commonly to trigger IBS symptoms, to make it worse, with worsening pain, bloating, diarrhea, and constipation. Number 2, minimize your caffeine intake. You don't have to eliminate that. We know that caffeine can be a trigger when it comes to GI issues to make things worse. Number 3, minimize dairy. For some individuals that have IBS, it may be a lactose intolerant issue. And if that's the case, just eliminate dairy, eliminate milk, cheese, and just see how you do. Number 4, remove artificial sweeteners. Things like sorbitol are things that you may not be able to digest. We find these ingredients in diet drinks, in chewing gum, and foods like that. So check out the ingredients and try to eliminate that from your diet. Keeping a food diary can be very helpful for you to know what your particular triggers are, so you can find out what is good for you and what is not good for you for your own particular body. Number 4, try a low FODMAP diet. Out of all the diets that are out there, the one that has the best evidence behind it in terms of controlling IBS symptoms is a low FODMAP diet. FODMAPs are certain foods that are known to cause gas, bloating, and distension. And these foods can also be healthy foods that you may not realize are some of the causes for some of your issues. The important thing about this diet is that it's very important to get the help of a nutritionist while you're on this diet, because it's not the right diet for everyone, and sometimes you can actually have nutritional deficiencies while being on this diet. Tip number 5, stay hydrated. Hydration is key. Hydration will keep you fuller longer and more often. Hydration will help move things along and also help out when it comes to your GI tract as well. So here's what I tell my patients. Aim for 2 cups of water in the morning, 1 cup before each meal, and 2 cups before you go to bed. If you do this, this will give you enough water throughout the day to keep you hydrated so you can help out with your GI tract and your gut issues. At the same time, avoid carbonated drinks and avoid excessive caffeine, because these are particular drinks that can make your IBS symptoms worse. And then lastly, exercise. Exercise is incredibly important when it comes to your gut health. Exercise will help regulate your mood, regulate your bowels, help you handle stress, but also help you handle IBS issues that are going on as well. Studies have shown that the physical act of exercise can literally change your gut microbiome from the inside out. And for a lot of my IBS patients, the root issue of why you have IBS and leaky gut is a change in the gut microbiome. And I recommend my patients aim for 30 minutes of physical exercise every single day. Make this a priority for you so you can get you feeling better and hopefully allow your gut to heal itself on the inside out. So there you have it. These are my simple 6 steps that I recommend to treat your IBS naturally. No matter what type of IBS that you have, try to incorporate all these steps to get you feeling better. So my question for you is, have you tried these steps? What has worked? What hasn't worked? What else would you add to this video? I'd love to hear what you guys have to say. Thank you for watching. Don't forget to smash that like button, like, share, and subscribe. Look forward to seeing you guys on future videos. And if you want to learn more about what you can do to get your IBS controlled, come see us up at Gash, where we are experts on IBS. And I have a lot of videos in which I recommend for my patients when it comes to dealing with their IBS symptoms.